Okay, this video is called Technology Tunnels in Healthcare. And like, what does it really mean? What I mean by that is the average person tends to be very impressed by the idea of science. And in the modern society, they think that science has replaced God. Who needs all that stupid religion stuff? We've got science and technology. And what I can tell you is when I hear the word science or evidence-based medicine, to me that's like a euphemism for advertising. Okay, any science that contradicts what big money wants, it doesn't ever, get into the journals. Okay. And so what I'm trying to say is the patient thinks, oh, they want something scientific, and I'll show you what really happens. Okay. Let's say the patient says, I want to be proactive. I know I've smoked. I don't want to quit smoking, but I'm going to go for a lung cancer screening test. Okay, a smoker, an asbestos worker. They get the lung cancer screening CAT scan, and what does it show? It shows a couple of subpleural micronodules that are going to need follow-up for at least 2 years. Maybe a ground glass nodule is going to need follow-up for 4 years, maybe 5 years. And then look, there's an atypical kidney cyst because it's a low-dose CAT scan. There's noise in the cyst. Better send them for an ultrasound. Small septation. It's probably a Bosniak 1. Bosniak 2, but we don't, we better just get another follow-up. They stuck in that for years. Low-density liver lesion. Let's get a liver MRI, make sure that's nothing. A little cyst in the head of pancreas. Get a pancreas MRI, make sure it's nothing. And the point I'm saying is they could go for a free lung cancer screening test, and pretty soon, $25,000 later of all these tests and follow-ups, it could become pretty expensive. Also, they've got all this stress and worry. And at the end of it, they still smoke and they're still eating a junk food diet, so they don't really have much protection. They're assuming that the treatments for these things really make much of a difference. Okay, when what was the smart thing to do? Just quit smoking, eat the low-fat, low-sodium vegan diet. In the populations, like the Asian populations, Papua New Guinea, where they were smoking like chimneys, they had much less lung cancer than the Americans because it's a synergistic effect of the high-fat diet and the high-meat diet increasing the risk of lung cancer. They had 6.1 times more lung cancer in the USA than they did in Papua New Guinea. Okay, the next thing, average frustrated chump ends up going for a treadmill stress test, had a little tightness in the chest. And then Dr. McDougall would jokingly call the treadmill stress test a conveyor belt to the operating room. Next thing you know, they're on the cardiac cath lab table, pop in a couple stents, not too far down the road, they got more problems, go for open heart surgery, CABG, coronary artery bypass graft. So what I'm saying is the patient's never taught about the low-fat vegan diet, which could have just cured his coronary artery disease. He wouldn't have to bother with any of this stuff. Okay, but the patients are awed. Wow, cardiac cath, interventional cardiologist. Oh my gosh, this is so amazing. Open heart surgery, heart-lung bypass. Wow, isn't this amazing? Well, all you got to do is, eat your fruits and vegetables. You could avoid all this stuff. The other thing too is, I want to be proactive. I'll check my PSA, prostate-specific antigen. It's a blood marker of increased risk for prostate cancer, and they think it's an intelligent thing to do. But then PSA is high. They go for a biopsy, a big sextant biopsy, like 12 big needles up their butt. They're very painful. And then they, might have some incontinence just from that. Might have some impotence from that. Probably not. But then they go for the prostatectomy. They got a low-grade prostate cancer. They go for prostatectomy surgery. All of a sudden, they're incontinent. They're wearing a diaper, and they're impotent. Is that really what you wanted to happen? Okay. You could go low-fat, low-sodium vegan like the Ornish diet. Lower your risk. It's probably a turtle anyways, slow-growing cancer that might die from some other reason. What I'm trying to say is the patients glamorize in their mind's eye this idea of technology. When they hear buzzwords, like I'll tell you a typical prostate cancer patient. This guy had prostate cancer. He decided he was going to go for prostate surgery. He went to a big fancy university, like the biggest fanciest university near where I live, all right? And he said he chose that because they had all the bells and whistles, robotic assistance, prostatectomy surgery. He thought that sounded cool. They lacerated his rectum. He spilled stool all over his abdomen. He had like about 6 different abdominal abscesses. I drained 5 of them. There was one that was retroperitoneal next to the aorta and blocked by the spine. I couldn't get to it. We just treated him with antibiotics for like 6 months. He ended up doing okay, but why put yourself through all that? McDougall's father-in-law had prostate cancer. He just told him, eat the low-fat, low-sodium vegan diet and don't do anything. Now, don't get me wrong. There's different types of prostate cancer, whether or not it's metastatic or not, high-grade, low-grade, fine. Okay, but what I'm trying to say is people who eat low-fat, low-sodium vegan, they dramatically reduce the risk of all this stuff. And then the risk of a complication or a false positive, a turtle, is much higher than the risk of anything helpful happening. So you don't have to bother with this stuff. You can escape from this game. Okay, the other thing is the average frustrated chump is sad because, whatever personal problem he's having. So somebody tells him, oh, go talk to a psychiatrist. Brilliant. Psychiatrist puts him on pills. They put him on pills for something. Okay, anxiety, depression, bipolar, who knows what. And all of a sudden he's got the equivalent of a chemical lobotomy and his cognitive functions going down. So most of this high-tech stuff is overrated. I show you this because I'm trying to help you understand how it works. That you have to ask yourself, what disease do I have, or what disease am I worried about? How could I prevent this disease? What are the risk factors for this disease? What causes this disease? Let me make a list of all the things that cause this disease, and I'll avoid all of them. And I'll be as healthy as I can in general. I'll get my sleep. I'll avoid stress. I'll avoid caffeine. I'll avoid alcohol. I'll avoid high-fat foods. I'll avoid stimulants. I'll avoid excitotoxins. I'll have a sense of purpose in my life. I'll be religious. I'll try to maintain my social support system. I'll get my sleep. All that stuff prevents most of this stuff. Okay, and then I'm also going to show you, what is disease about and what's the healthcare system about. All doctors, our entire public school system is based on Darwinism. Okay, the religion of the modern Western countries is based on Darwinism, and atheistic Darwinism. It says that man has no soul, that man is just a primate, a monkey that talks. And because he's just a monkey who talks, there's nothing special about him compared to a chimp except he talks. Okay, he's got a little more IQ, but it's not a significant difference. And once you go down that path of atheistic Darwinism, it means that there's nothing special about the person. There's no reason to do anything for them, okay, except to get money out of them. Okay, and that's why you don't want that. Now, I know this will never be allowed, but this is the only thing that could save healthcare. And so because this is never going to be allowed, it's never going to be saved. That man is created in the image of God, therefore part divine as well as part beast, therefore entitled to our best effort. Therefore we should do right by him no matter the cost, because, he is precious, okay? You have to have that. Otherwise, there's, like I said, there's $150,000 for open heart surgery, a cabbage. You think anybody's going to do that? Going to back off on the cabbage or the stent for $30,000 when you get $0 to $1,000 for teaching the vegan diet? There's Jesus Christo on the Sermon on the Mount, And let me just show you Matthew 25:40. Here's Matthew 25:40. He humbles himself before the disciples and he says, Matthew 25:40, that which you do unto the least of my brethren, you do unto me. You have to have that attitude. We will do right by this patient no matter what. And that's why the parents are the best people in the world for a child. Even if they're both a functional illiterate, I don't care. I trust those parents 1,000, 1,000,000 times more than I trust that public school psychologist idiot who's trying to talk them into castrating themselves with all the modern nonsense, okay? And here's the same thing again. Jesus Christus, Matthew, chapter 25, verse 40. Truly I tell you, whatsoever you did to the least of my brethren, my brothers and sisters, you have done unto me. That is the attitude that could fix healthcare, but it will never, ever be allowed. So healthcare will never, ever be fixed. And that's why, I know it'll never be fixed, because there's just too much money to be made off taking advantage of chumps. So that's why you have to be as knowledgeable as you possibly can when you or somebody in your family goes into the healthcare system, because it does have some good tools, antibiotics and a lot of skill in treating acute disease, a lot of skill in treating complex chronic disease, but most of the people, why they're sick is because of dietary disease. And the only way to cure a dietary disease is to fix your diet, or at least to prevent it from progressing. So anyways, hope that was helpful.